I'm Vargas at NYC, and one of the biggest questions I get asked is, what is a knot? A knot pretty much is something called an adhesion, or it can be scar tissue. An adhesion is scar-like tissue that forms between two different tissues, and it pretty much glues it together. What that's going to do is, it's going to decrease your range of motion, it's going to make it harder for you to do certain actions, and it's going to make you uncomfortable in your everyday life. So instead of having range of motion out of your hip going up to like 90 degrees with a straight leg, you might get it up to like 40, 60, and it could not just be just tight hamstrings, it's actually scar tissue or adhesion that's preventing you from doing the whole motion. Another thing that people ask me is, they have glute pain that accompanies their lower back pain. What is that all about? See, the sacrum pretty much stabilizes the spine, and most of the glute and hip muscles come off the sacrum into the hip. One of those muscles is the piriformis. When the piriformis gets really, really tight, it's located directly over the sciatic nerve, so it might impinge upon that sciatic nerve, causing you to have sciatica-like symptoms. So a good stretch for most of you guys to do is, you sit down here. Okay, so from a sitting position, all you're going to do is cross your leg into a figure 4 position. From here, all you have to do is lean forward at the hip, and you're going to feel a stretch right on your glute. So you're going to feel it on your left side if your left leg is up. You hold it from 15 to 25 seconds, somewhere in between that range. Once you're done with that, do the same exact thing for the opposite side, just leaning forward. A good thing about the stretch is, for most of you guys that are in a cubicle or at a desk all day, you can do it at your seat. So if you're starting to get it cramps out your lower back, or your glutes are starting to hurt, just do this stretch in the interim, it'll help you out a lot.